It should come as little surprise that two of the most pressing dangers to public health facing the United States today are obesity and type 2 diabetes. The former, affecting more than 100 million adults around the country, sharply increases the risk for the latter, which accounts for more than 90% of the 38 million cases of diabetes mellitus. Perhaps most troubling is that more than 8 million people who meet criteria for diabetes may be unaware that they have it. One encouraging development has been the release of a class of medications, glucagon-like peptide 1, or GLP-1, receptor agonists. They've proven to be remarkably effective in helping patients manage their blood sugar and weight. This class of drugs includes semaglutide, which is Ozempic and Wegovy, liraglutide, or Victoza, and dulaglutide, or Trulicity. They often allow patients to lose significant amounts of weight even when treatment is not paired with lifestyle interventions, and they're being prescribed frequently, with as many as 1 in 5 individuals with type 2 diabetes using them as of 2022. Reducing obesity can lower the risk of high blood pressure, cardiovascular disease, and numerous other complications associated with type 2 diabetes. However, these drugs may also help treat pathologies that do not seem to be closely tied to obesity. Preliminary research even suggests that they may be useful in treating psychiatric conditions like addiction and preventing the progression of neurological disorders like Alzheimer's disease, with countless other possibilities yet to be explored. Here's how. Synthetic GLP-1 agonists mimic the hormone GLP-1, which is released in the gastrointestinal tract after eating. GLP-1 triggers the release of insulin, which helps regulate blood glucose levels by encouraging cells to absorb glucose and use it for energy. Patients with type 2 diabetes either do not make enough insulin to properly regulate their blood glucose, or they've developed insulin resistance, meaning their cells are less sensitive to insulin signaling. Since these processes do not occur concurrently, most people experience years of prediabetes, typically due to genetics, a sedentary lifestyle, or a diet higher in sugary and overprocessed foods. Their cells develop a greater tolerance to insulin, eventually turning into insulin resistance. A person becomes diabetic when their pancreas can no longer produce enough insulin to maintain healthy blood glucose levels. By encouraging the release of insulin, GLP-1 agonists can help individuals with type 2 diabetes better manage their blood glucose levels and avoid complications associated with the disease, such as chronic inflammation, nerve damage, and diseases affecting the kidneys, eyes, and cardiovascular system. Yet, it became clear early on that the benefits of GLP-1 agonists were not just limited to the treatment of diabetes. They also helped patients lose weight. Consequently, for years, many medical professionals have used GLP agonists off-label as a means of weight management. More recently, however, the FDA formally approved their use in the treatment of obesity, as they not only help stimulate the release of insulin, but also slow the digestion of food, leading to prolonged feelings of satiety. GLP-1 agonists also appear to act on certain parts of the central nervous system, most noticeably the parts of the brain in charge of appetite and eating behaviors, as well as the reward centers. These drugs don't just affect the organs in the GI tract, they act on areas of the brain deeply tied to emotion and motivation, altering individuals' psychological relationship with rewarding activities and modifying reward behavior accordingly. This change is something that patients consciously notice and report. After starting treatment with GLP-1 agonists, many describe not only a reduction in appetite, but a psychological change in their relationship with food. Most important, they describe being less burdened by preoccupation with food. Known colloquially as food noise, this might include intrusive, overwhelming cravings for highly palatable and unhealthy foods, a compulsive desire to order delivery or pick up fast food, even when healthier options are readily available, or being so preoccupied with food that they're always thinking about what they'll eat next. even in the middle of a meal. GLP-1 agonists can turn down this noise, not necessarily eliminating it, but making it quieter and easier to ignore. Studies on the neurological mechanisms underlying addiction have typically focused on dysregulations involving dopamine and dysfunctions in brain areas that regulate reward-seeking behavior, emotions, memory, and decision-making, a list that includes the dopaminergic mesolimbic system, the amygdala, the medial prefrontal cortex, and the hippocampus. Many hypothesize that GLP-1 agonists can inhibit dopamine release in at least one of these regions, resulting, potentially, in the dampening of maladaptive noise. But the exact mechanism is still unclear. Still, the idea that food noise and drug noise may be in some way related, and that GLP-1 agonists could quiet the latter just as they do the former, has a small but growing body of evidence in its favor. Already, several studies conducted on both animals and humans support the idea that these drugs could help promote abstinence among patients with alcohol, cannabis, and opioid use disorders. In one randomized double-blind trial of 20 participants with opioid use disorder, those who took liraglutide, or Victoza, reported a 40% reduction in opioid cravings compared to those who took a placebo. A much larger trial testing whether semaglutide, which is Ozempic or Wegovy, triggers the same effect, is already underway. The potential benefits of GLP-1 agonists don't stop with addiction. Even more recently, a study not yet published has found that these drugs could also help slow cognitive decline in patients with Alzheimer's disease. According to lead author Paul Edison of Imperial College London, who presented the findings at the 2024 Alzheimer's Association International Conference, patients with Alzheimer's disease who were given liraglutide had nearly half the volume loss in areas of the brain associated with memory, language, and executive function, as measured by MRI. Over 12 months, the liraglutide group also reported an 18% slower decline in cognitive function when compared with the placebo group in the study. As in addiction, what remains an open question is how these drugs can further neuroprotective qualities in patients with Alzheimer's disease. While the cause of Alzheimer's is believed to center on the abnormal buildup of plaques and protein tangles around neurons that ultimately become toxic and metaphorically suffocate brain cells, current research indicates that GLP-1 drugs do not directly clear out these harmful plaques. Arguably more likely, GLP-1 agonists reduce neuroinflammation by counteracting insulin resistance in the brain, just as they do in the rest of the body. The resultant reduction in blood glucose levels likely prevents inflammation and slows disease progression. Chronic neuroinflammation caused by the hyperstimulation of the brain's immune system is believed to exacerbate Alzheimer's. While some inflammation is beneficial, being in a chronic pro-inflammatory state disrupts critical networks in the brain and promotes biological aging at the cellular level, which aggravates Alzheimer's pathology and worsens symptoms. Neuroinflammation may not cause Alzheimer's, but it speeds up the disease progression. Taming it with GLP-1 agonists could counter that effect. Alzheimer's is just the tip of the iceberg. Neuroinflammation is implicated in a host of other neurological and psychiatric conditions. Over the last 10 years, research has been published strongly suggesting a link between chronic stress, neuroinflammation, and anxiety and mood disorders, including panic disorder, generalized anxiety disorder, and depression, particularly the more severe and treatment-resistant types. GLP-1 agonists' effect on neuroinflammation must still be validated with further research. But if it is, it may offer a pathway to relief for millions more people struggling with their psychological and neurological health. The author of this article, Samoon Ahmad, is a clinical professor of psychiatry at the NYU Grossman School of Medicine, and he's the founder of the Integrative Center for Wellness in New York City.